estimated that around 2.7% of those in the United States have intermittent explosive disorder. Welcome back, Straight Talkers. Today I'm going to talk about intermittent explosive disorder and how psychiatrists go about making this diagnosis clinically. But first, make sure to hit that subscribe button so that you can be the first to know when new content comes out. Intermittent explosive disorder is listed under the section Disruptive Impulse Control and Conduct Disorders in the DSM-5. The core feature of intermittent explosive disorder is a failure to control impulsive aggressive behavior that is in response to some sort of provocation or stressor, and we typically will see symptoms be chronic and persistent over the course of many years. And it's often seen in younger individuals, being most common in late childhood or adolescence, and rarely begins for the first time after the age of 40 years old. It's also commonly seen in those with a high school education or less. Now, how do psychiatrists go about making the diagnosis of intermittent explosive disorder? So when evaluating for this, there's 6 criteria that we take into consideration, and these are listed from A to F in the DSM-5. Criterion A states that there are recurrent behavioral outbursts representing a failure to control aggressive impulses as manifested by either of the following. 1. Verbal aggression, such as temper tantrums, tirades, verbal arguments, or fights. Or physical aggression towards property, animals, or other individuals. And the physical aggression does not result in damage or destruction of property and does not result in physical injury to animals or other individuals. And these acts of aggression need to occur twice weekly on average for a period of 3 months. And then 2, there needs to be 3 behavioral outbursts involving damage or destruction of property, or physical assault involving physical injury against animals or other individuals occurring within a 12-month period. Typically what we see is that outbursts have a rapid onset and they often last for less than 30 minutes. And they commonly occur in response to a minor provocation or stressor, which leads us to criterion B that states the magnitude of the aggressiveness expressed during the recurrent outbursts is grossly out of proportion to the provocation or to any precipitating psychosocial stressors. Criterion C states that the recurrent aggressive outbursts are not premeditated, meaning that the behaviors are impulsive or anger-based in nature, and they're not committed to achieve some sort of tangible object such as money, power, or intimidation. Criterion D states that the recurrent aggressive outbursts cause either marked distress in the individual or impairment in occupational or interpersonal functioning. So what I'll commonly hear is that outbursts will lead to a loss of friends and family members, or they'll cause marital instability. Others will struggle with work and will experience demotions or loss of employment. And behaviors can also be associated with financial or legal consequences. Some people will struggle financially because they'll have to repeatedly replace objects that are broken and destroyed. And then the legal struggles will often include civil suits that are a result of aggressive behaviors against others or property, or even criminal charges for assault. Criterion E states that the chronological age of the individual is at least 6 years old. And lastly, criterion F says that the recurrent aggressive outbursts are not better explained by another mental disorder, such as a major depressive disorder, bipolar disorder, disruptive mood dysregulation disorder, a psychotic disorder, antisocial personality disorder, or borderline personality disorder. In addition, the symptoms are not secondary to the physiological effects of a substance such as drugs, alcohol, or medication. Whenever I make the diagnosis of intermittent explosive disorder, I will always screen for mood disorders, anxiety disorders, substance use disorders, personality disorders, and other disorders with disruptive behaviors, as these are highly comorbid with intermittent explosive disorder. If you have concerns that you or your child are struggling with these various signs and symptoms, please do not hesitate to reach out and make an appointment with your primary care doctor or psychiatrist to get further evaluated. Thanks for watching this video. Now head on over to the next one to find out more ways that you can live your best life.